Blood has to continuously flow within the circulation, and in order to flow, it has to remain in a liquid state. However, it also must have the option to go into a solid state when there is bleeding as a result of, say, a cut or a breach in the blood vessel. It needs to form a blood clot that would plug the breach in the blood vessel so that uncontrolled hemorrhage does not occur. Therefore, it will be evident that a balance needs to be achieved between coagulation, which is the process of blood clotting, and formation of a solid state, with anticoagulation, that is the process of blood stopping the blood from clotting. Too much coagulation would cause clotting in the blood vessels, which is referred to as thrombosis, and too much anticoagulation would predispose to bleeding. In order to maintain blood in circulation, therefore, requires an inbuilt process to ensure blood does not clot and it remains in a liquid state. Now, several factors facilitate this natural anticoagulant process. Firstly, blood has to flow smoothly in an uninterrupted laminar pattern. Now, laminar flow ensures that the red cells remain in a central column, with the platelets separated from the endothelial surface by plasma. Platelets can be activated to initiate blood clot formation if they are subjected to shear stress and if they make forceful endothelial contact, and therefore keeping them away from endothelial cells reduce the risk of thrombus formation. In laminar flow, the plasma remains as the outermost layer that keeps in contact with the endothelial cells. As plasma contains various anticoagulant components, this close contact helps prevent the process of coagulation being initiated in the absence of endothelial injuries or cuts. The intact endothelial cells themselves have specific anticoagulant properties that prevent coagulation as long as they are undamaged. Similarly, blood harbors intrinsic anticoagulant properties, and these needs to be preserved in order to ensure that the blood does not coagulate in the blood vessels. Deficiency of any of these natural anticoagulants can predispose to thrombosis. While coagulation itself is a physiological process that kicks into place to prevent hemorrhage or bleeding when there is a cut in the blood vessel, thrombosis is a pathological condition that occurs from the abnormal activation of the coagulation cascade or disruption of normal anticoagulation processes within the vascular space. Thrombosis leads to the formation of a thrombus within the blood vessel, and by definition, thrombosis is the formation of a solid or semi-solid mass from the constituents of blood within the vascular system during life. This is in contrast with a blood clot, which merely means the solidification of blood when there is a cut or breach of the blood vessel and should be extravascular rather than intravascular. Disturbances in any of the elements that maintain blood in a liquid flowing state will predispose to a prothrombotic state, and this is exemplified by the Virchow's Triad described in 1856 by Rudolf Virchow, a renowned German scientist and physician. Now, Virchow proposed that thrombosis is predisposed when there is blood flow disturbances that causes stasis and turbulence, or when there is endothelial or vascular wall damage or injury, or if the blood is hypercoagulable due to deficiency of antithrombotic factors or excessive activation of prothrombotic factors in plasma. As described earlier, laminar flow has red cells in the central axial flow, with separation of platelets from the endothelial surface and plasma containing anticoagulants lining the endothelial cells. Turbulent flow is created when the vessel walls are not smooth. Turbulent flow is associated with eddy currents that throw platelets against the vessel wall. The platelets are then subjected to shear stress and are activated as they are thrown against the endothelial surface. Stasis, meanwhile, occurs from impaired venous outflow or obstruction that causes congestion. Now, prolonged contact of red cells, platelets, and clotting factors with endothelial cells can then predispose to the development of thrombosis. Factors that can contribute to turbulent blood flow includes vessel wall irregularities such as atherosclerosis, cardiac arrhythmias such as atrial fibrillation, non-natural surfaces such as cardiac prostatic valves, and anatomical abnormalities of blood vessels such as aneurysms. Stasis, meanwhile, is commonly caused by impaired venous outflow, especially from the deep veins of the leg. The venous system itself is a low-pressure system that often has to flow against gravity. And in order to facilitate this flow, leg muscles contract to push the venous blood up against gravity, and the venous valves ensure one-way flow of blood towards the heart. Insufficient contraction of the leg muscles may impair blood flow in the veins of the leg, causing stasis and predisposition to thrombosis. Stasis can therefore occur when there is prolonged inactivity, such as sitting still within a cramped space, as can occur during long-haul flights, a condition referred to as economy class syndrome, or may occur following surgery, or when you are being bed-bound with prolonged immobilization, or if there is hyperviscosity of the blood, when the blood is thick and viscous, as can happen in conditions like polycythemia rubra vera and sickle cell disease. Stasis may also occur when there is vessel wall obstruction or compression, such as compression of the iliac veins during pregnancy, or when there is external compression from an adjacent tumor. Endothelial and vascular wall injury predisposing to thrombosis, meanwhile, may occur when there is atheromatous plug rupture, or when there is endothelial injury that is caused by things like surgery, inflammation from vasculitis or infections, and smoking. Hypercoagulable states, meanwhile, can be due to acquired or modifiable factors such as hyperlipidemia, smoking, obesity, and certain malignancies, or it may be due to inherited or non-modifiable conditions such as protein C, protein S, or antithrombin deficiency, of which all are natural anticoagulants that would inhibit coagulation. Other heritable conditions predisposing to thrombosis include unusual conditions such as factor V Leiden and hyperhomocysteinemias.